we're looking at the connection between health equity and network adequacy. It has long been reported that CMS and other state governments are trying to increase responding to the health equity needs of patients out there. And CMS, they have said that they are looking to incorporate health equity considerations into network adequacy. Now, we don't know if there will be any health equity network adequacy provisions in the NBPP that's coming out in January. But we've seen states incorporate health equity considerations into network standards. And that's interesting because sometimes what states do, they trickle up to what the federal government does, and other times what the federal government does trickles down to what the states do. And we can talk about a few of those examples here. One that we've seen is related to public transit. So this is all about ensuring that health plans have providers that are close to public transit to ensure that members that don't have access to cars and things like that can get to see the doctor. In Washington, D.C., we saw a proposal out there that would require health plans to ensure that they have providers that are within a half a mile of a metro stop in D.C. So that's one interesting network-related way to address the health equity needs of the population. Another one that we've seen is in Oregon, again, a proposal that would require health plans to address in a network adequacy report how they are meeting the needs of LGBTQ population. So what are those network-related provisions that the health plan has in place to ensure that LGBTQ enrollees have access to healthcare providers that can meet their needs? And that could include access to provider types or provider characteristic types that have specialties that can meet their needs. Another one that we've seen is in Colorado, where they are undertaking a public option. This has generated a lot of headlines, and they've created new network standards in that program. And one of the things that they're looking at there is requiring that health plans ensure that they're contracted with providers that speak a language other than English. And this is to ensure that enrollees have access to healthcare providers in their own language. There's a lot of research out there showing that when a patient can get healthcare in their own language, that they actually have better health outcomes. And so it's an attempt to get at that. Those are the kinds of trends that we're seeing across the country, and we expect to see this in greater detail in the coming years.
It's crazy to see how much everything is growing. It just sounds like, everyone is looking for more information about the providers that they're going to, both from the patients to any of the partners out there to the regulators. And it's all in an attempt to really make sure that we are delivering the best healthcare services that we possibly can and meeting everyone's needs. So it's great to have the update on what's going around. It kind of sounds like from the country and all the different moving parts and how a lot of the states are looking at things differently. And I believe that we'll probably continue to see a creativity level come forward as well as we continue to watch this. So thank you so much for the update on all of that information.